Hello and welcome, everyone. Very excited to have each and every one of you here as we explore coaching for health and wellness professionals. Couple of quick FYI pieces of information. First off, yes, you're all in mute mode. My apologies for that. With the number of people on the call, that is a necessity so we can manage background, etc. What that means for you is when you have a question, please type it into the question panel on your screen. I will monitor that as we go through the program. In addition to that, I will be saving the recording for this program, loading it on our YouTube channel, and a link to that will be emailed to all of you. So I already know sometimes people ask, hey, will we have access to this again later? Yes, that's coming. Okay, in terms of the conversation today, let's set it up with the story. And through this story, explore what does it really mean to be a coach and or to be a health and wellness coach. So here's the example for you, and it's set up, by the way, some of you who are coaches with us, it's set up similarly, different client story. So a client calling asking about coaching services. And what this particular client shared with me brings up the question we often ask ourselves. Are we to be a process expert in coaching, or are we to be a subject matter expert in coaching? So let's explore that through this example. In this case, the client said, you know, I've got a lot of barriers in front of me. I want to advance my career, and I'm struggling to get there. So as a coach, one of the things we know is that it's actually a balance in terms of process expert and subject matter expertise. You see, when you have subject matter expertise on the pro side, you understand what the client's talking about, you've got information and resources, etc. So that's great. You know what to ask the client. Now, on the con side of subject matter expertise, it does sometimes get in the way. Because if you know the answer, then it becomes your agenda instead of the client's. And that gets in the way of effective coaching. So what we know in coaching is that you want to, first off, check with yourself. Okay, do I feel comfortable coaching the client on this topic? Do I know enough about the subject to be up to speed with them very quickly and to be effective asking questions? And you want to know, as a coach, that you have process expertise in terms of the coaching. Then, after you check with yourself, you're going to have the same conversation with your client. Here's what I do and don't know on this topic. Here's what I offer. And the client gets to make the choice. So in this case, the client was working with some barriers in terms of their career. I do a lot of career coaching, felt comfortable going there and having that conversation. So I shared with the client what my experience was, and we engaged in the coaching process. As we dug in to what my client wanted in terms of career, here's what we found out. She was actually dealing with some very serious medical issues. And that was, in fact, impacting her ability in terms of attendance at work, in terms of what she was capable of doing on the job. So then as we discover this, as a coach, I again am checking with myself, am I comfortable talking about this and having this conversation with the client? And of course, I'm checking with the client. Now, in terms of medical, here's an interesting thing. People say, okay, if I'm going to be a health and wellness coach, am I supposed to be an expert on the medical side? Am I supposed to be an expert on the coaching side? What is it? And there's actually a blend. So if you're going to call yourself a coach, of course you want to be a coach. You want to have training as a coach. In terms of health and wellness coaching, there is an expectation when you identify yourself that way that there is some level of expertise. Now, personally, my expertise is somewhat limited in terms of the health and wellness. That's the reason I tap experts like Lisa, who's actually on the call with us today, for the health and wellness coaching. She's got the expertise there. Now, of course, the other thing that comes up in coaching is that the number one indicator of success in the relationship is the rapport between the coach and the client. Well, this client was comfortable with me. We had been working together, etc. We knew my lack of knowledge and expertise in terms of the health and wellness. So we talked about it, and we talked about it. How are we going to effectively move forward in this coaching relationship so the client gets what is appropriate for her and I'm supporting her effectively as a coach? And we co-created our plan for how to work together in terms of the client addressing the medical. So my area of work was the impact it was having in terms of the career and pushing her and challenging her in terms of educating herself and being proactive with what is possible for her to do. Now, as we moved into this area, the next question came up. Of course, you knew that was coming, right? So the client said, okay, money. Money is definitely a factor. It's impacting me because of the health stuff. It's impacting me because of the job stuff. Got to have that going on. So what do I do as a coach? I check with myself. Now there's an area where I have more expertise. Great, I'm more comfortable there. Oh, wait a minute, I got to check with myself. Can I make sure that I keep my expertise in terms of budgeting, etc., out of the way? Because it's not up to me to impose what I think is the right answer. It's up to me to support the client in finding their own answer. So I check with myself. And then I check with my clients. And we decided, yeah, we feel good about working together on this, and we continued. Now, of course, as we continued having this conversation, the clients started getting all confused. Where am I going? How am I getting there? And started bringing up ideas of, okay, do I want to retire? It's an early retirement. I won't make as much money. Do I want to do that? And then the possibility of, okay, so if I do stay in the job, how do I do it and make sure it's working and I can make enough money? Or, oh, gee, maybe I'll do something in between and consult, or maybe I'll start my own business. She was all over the place. Now, as a coach, what do? Of course, I'm checking with myself. I'm checking with my client. Am I going to be effective coaching this person as she went through and explored and considered what she wanted? And I, again, offered, here's what my background and experience is, here's how we can work together. The client said, here's what I want out of it, and we continued. And of course, as the client moved forward and started making decisions with what she was doing in terms of her career, her work, etc., we did come full circle back. And she said, you know, I've really got to have a plan for being as healthy as I possibly can be. And again, back to that, okay, am I an expert in this area? You know, I know a little bit, probably not the expert in it. What level of expertise does my client want? How can we work together? Am I going to be the most effective coach for her? And we talked it through. And again, figured out, okay, so where I can support her is in her plan for what research she wants to do, planning accountability, and where she was going to take ownership was in being her own best expert. So in checking in on that, we continued that coaching engagement. So what are the takeaways? When you think about being a health and wellness coach, what does that mean? What level of expertise is required? Well, and think about it, health and wellness, that is so incredibly broad. You have people that have a medical background, doctor and nurse. You have people that have insurance background. You have people that have personal training backgrounds, et cetera, et cetera. Very, very different areas of expertise. What's essential to be aware of here is, number one, checking with yourself. What expertise do you or do you not have? Checking with yourself, are you going to be effective as a coach in this regard? So that if you have little to no expertise, are you being clear on that and being clear on how you are going to be helpful as a coach? If you have a lot of expertise, are you clear with yourself on making sure that doesn't get in the way, that you really are empowering the client in their own decision making? So that means tapping your expertise appropriately in terms of understanding the client and asking them questions. So hopefully this story has set up some insight, answered some questions, and a great start to where we're going with the rest of the conversation. So what is our agenda? We're going to explore some specific definitions. We'll talk about differentiating coaching from other roles. We're going to explain coaching and coaching ROI in more depth. We'll list the 11 core competencies for a coach, talk a little in terms of coaching tools and techniques to give you examples and insights. For those of you that are certified as coaches, this is great review. For those of you that are thinking about it, this is great insight in terms of what to look for in a training program. And then we'll talk about coaching as a health and wellness professional, plus great resources for you. So first off, what is health? Well, if I went online and I look, the Merriam-Webster's dictionary defines health as the overall condition of somebody's body or mind. Okay, so if that's what health is, then what's wellness? In this case, I went to dictionary.com, a little more comprehensive in terms of what it said. And one of the definitions for wellness is the quality or state of being in body and mind, especially as the result of deliberate effort. So let's pull all of that together. And at the Center for Coaching Certification, what we did is created a diagram, an infographic, if you will, to help clarify what does this really mean, what's this about. And by the way, I mentioned Lisa's on the call. She offered a lot here. So thank you, Lisa. I got to give you a lot of credit here. So health is elements of medical condition, your medical care, your prognosis. Wellness is the knowledge you have, your perception relative to your condition. So think about it. You can have two people with the exact same medical condition, and one of them perceives themselves as, you know, I'm so unlucky, this is terrible, and I've got to deal with this for the rest of my life, and this is horrible, and that's where they focus. And you can have the other person say, you know, I'm lucky. I'm learning from this. It could be so much worse. There are things I can do, etc. So their perception of the condition makes a big difference in terms of what they're doing. It includes their action, what they are doing, what they're willing to do in terms of proactively maximizing their own health and wellness. And yes, there are going to be certain conditions that are what they are. The question is, are they maximizing it? So the overlap between health and wellness becomes the medical condition and care, how it contributes to the wellness of the individual. And the more people are involved and engaged in their own health and wellness, the further ahead they are in terms of maximizing their health and wellness. So when you talk about health and wellness coaching, what's going on with defining that? Well, again, I went online and did a search, and I found this really interesting. So one example of a definition that was available online is that a health coach is a wellness authority and supportive mentor who motivates individuals to cultivate positive health choices. They educate and support clients to achieve their health goals through lifestyle and behavior. Okay, here's what I'm going to challenge and push back on. I want to take off the word mentor, and I want to take off the word educate. You see, a coach is not someone who tells or advises. That's a very different role. Is there room for that role in this relationship? Well, absolutely. Let's be clear on what the role is and when it's in play. So, for example, a different definition on health coaching said health coaches educate. Okay, wait a minute. Let's take off the word educate. Health coaches support people to build healthy new habits and create sustainable lifestyle changes. There's a big difference there. You see, coaching is powerful and effective because of how it is different from educating and mentoring. Is there a time and a place to have an educator or a mentor? Of course there is. We all want the opportunity to learn from someone else's expertise. That's fabulous. And when somebody is in that role, then they're the expert. They're the mentor, the educator. When they're coaching, it's a very different role. So let's talk about that. What isn't a coach? Very specifically, a coach is not a mentor. They're not an educator. They're not a consultant. They're not a mental health professional, a doctor, a nurse, or a social worker. Those are all very different roles. And think about it. When you think about those different roles, many of them require very specific training and licensure. If you're calling yourself a health and wellness coach, that is very different than calling yourself a health and wellness consultant, educator, a doctor, a nurse, a psychologist, a psychiatrist, a therapist, a counselor, etc. Those are all different capacities. So what do these roles do that a coach does not do? In each of these roles, these individuals are assessing or evaluating what's going on. They're very often diagnosing, and in each case, they're giving information and giving advice. A coach does not do that. So, what is a coach? Well, let's define that. Go to the International Coach Federation, and they've updated their code of ethics, and right there you're going to find this definition. Coaching is partnering with clients. Okay, partnering right in and of itself tells us a lot. The coach is not the lead, the authority, or anything else. They are a partner, and that is different in terms of the role. It goes on to say, with clients in a thought-provoking and creative process that inspires them to maximize their personal and professional potential. So in other words, the role of the coach, instead of telling them what to do, is inspiring them to creatively explore, to go through a thought-provoking process in terms of what are their opportunities, what are their possibilities, what do they want to do, and how do they want to do it. So if I continue to dig into this, in terms of coaching, here's a definition Lisa and I worked on together. Health and wellness coaching is a strategic partnership wherein the coach works with the client to clarify goals, develop strategies, create action plans, and move past obstacles. It is understood here, this is key, that the client is empowered to make their own choices. A health and wellness coach serves the client exploring how to educate themselves, make decisions, and manage their health effectively with a focus on opportunities and follow-through. You see, the client making the choices is how coaching makes a difference in this relationship. Because, think about it, the reason in the health and wellness professions and industries across the board there is a growing interest in coaching is because what they're finding out is when the expert is telling the client or the patient what to do and how to do it, the client or the patient is hearing some of it, confused, unsure, they don't own it, and the follow-through is not happening. So if we want coaching to really make the difference, it's how we approach that role. Very, very important. So what does that mean? That means a health and wellness coach is knowledgeable. They're professionally trained. Yes. People say, do I really have to get training in coaching? I'm already a health and wellness professional. Great. Do you want me to call myself a health and wellness professional without any training? And the same is true. When you call yourself a coach, you need to be a coach. It just makes sense. It's respecting yourself. It's respecting your client or your patient. So being professionally trained, exploring the possibilities, defining priorities, creating a strategy, clarify objectives, develop action plans, move past challenges, and progress toward the outcomes the client chooses. Again, client choice. The health and wellness coach serves the client with a focus on priorities and as an accountability partner. That means that coach really owns it. So let's dig further in. I mentioned how important training is. Okay, let's be real. What are the reasons for training and what are the reasons against training? The reasons for training, bottom line, it's developing the skill set. Calling yourself a coach doesn't mean you know how to coach. As a matter of fact, there's a lot of misinformation out there about what it means to be a coach and how that coaching works. So it's developing the skill. It is a matter of professionalism. Bottom line, what industry or profession is there that isn't asking for specific training in that industry or profession? And ultimately, it means effective client care. And there's a huge difference there. Now, when people say, oh, I don't want to go to training as a coach, there are two key reasons, time and money. And we get that because realistically, it does take time and money to get trained, just like it takes time and money to become a doctor or a nurse. It takes time and money to become a personal trainer, et cetera, et cetera. So yes, we get that, and that's the key reason against. Now the question becomes, what are you going to do with that? If you want to call yourself a health and wellness coach, what are you going to do about that? So when you go to training, what are you looking at? Well, in terms of health and wellness, there's a combination. You see, there are 11 core competencies for a coach, and as promised, we will go through those. In addition to that, if you're specifically doing health and wellness coaching, there are strength areas that work with the competencies. One of those strength areas is subject matter expertise and how much of it is appropriate. Another strength area is role clarity, knowing the difference between being an educator or a coach, because those are different. It is important to have congruency in terms of who you are, how you present yourself, how that fits in the role, and healthy boundaries in terms of what you're setting up in that relationship. Checking with yourself, checking with them, what's appropriate, what's working, how do we function together? Look for that in a training program. All right, let's talk about blending the roles. If you are going to blend coaching and educating, what's going on? How do you do that effectively? So there are coaching skills that are incredibly helpful when you educate. As a matter of fact, for training professionals, coaching is considered a core competency, which means training professionals are getting trained in coaching. So what coaching skills apply? Well, asking the client for their answer. You see, we're so used to being the expert and telling them the answer. And it's easy to give people the answer. And think about it. How often do they take the answer you give them and actually use it? Not so often. That's the reason coaching is so powerful. So asking the client for their answer, very, very important. It also means asking the client how they will use the information. You see, I can give you lots of information and you can think, oh, this is great. Oh, yeah, I even, believe you, trust you, or whatever else it is. And the bottom line is, are you really going to use it? And if you're going to use it, how are you going to use it? You see, what happens is we get information. We all have lots of information. And then we fall back into our normal activities and routines. And guess what? We're not using it. So when a coach changes hats and is an educator, what they're going to do is ask the client for answers, and they're going to ask the client how they're going to use the information that's being provided. Now, Digging in further, what are some activities that occur when you're educating? You're using self-reflection. Sometimes that means a client working through a checklist, what's going on. Sometimes it means they're journaling. Sometimes it means they're tracking something that's going on. There are all kinds of activities that support both coaching and education. Brainstorming is an activity. So in a training program, an education class, you very often use brainstorming. It's a great tool, and you get everybody involved in that. You do that in a one-on-one coaching relationship as well. The client throws ideas, and here's the catch. So yes, as a coach, we throw out ideas. The important difference is we make sure it's multiple ideas, and we have zero investment in which one the client chooses. So we brainstorm. And another great tool is role-playing. You see, in educating people, you role play so that they practice whatever the skill set is. We do that in coaching as well. So there's a lot of overlap in these roles. Now, what about separating the roles? So we want to separate and have time for educating, because educating makes sense. It's important to provide information. We also want time for coaching, because the reason we're talking about health and wellness coaching is to get the impact of what coaching is and does. So how are you going to set this up effectively? If you're going into a coaching relationship, you're planning the time for educating and time for coaching. So one way to do it is to start out by defining what is the current status for the client. And this involves some of that self-reflection, that self-inventory, if you will, and you can specifically inventory their knowledge as well. So what is their medical and wellness condition now? What is their knowledge level? Then look at what are their options for learning more information. Some people do well with researching online. Other people do well with reading. People like to go and take classes, etc. So there's all kinds of options available for them. And it may be they want that one-on-one education from the person who is going to serve as both an educator and a coach. If you're going to go into a relationship where you're using both education and coaching, it's important to be clear on that. So what does that mean? That means discuss the different roles. What is an educator and what is a coach? And then as you set up your relationship, you plan time specifically. Here's time for education. Here's time for coaching. And you're very clear in terms of which role it is and when you are in that specific role. So the clarity behind it. Okay, so now let's go further with this and dig specifically into the coaching side. So in terms of coaching, there are different types of coaching. There's a lot of information available on the return on investment for coaching. And then, of course, as promised, what are those coaching competencies? So first off, in terms of types of coaching, there's life coaching. Now, what's interesting about life coaching is very often it does involve different health and wellness areas. So as one big example, you have people that are ADHD coaches. Well, yeah, we can certainly consider that a health and wellness area. And very often the coaching they're doing is life management skills, managing some of the different things that are going on for them. That's great. So it's life coaching and it's health and wellness coaching. It's got a lot of overlap. Another example there is if someone's retiring. Well, when they're retiring, certainly medical conditions are coming up, the health and wellness becomes a factor, and it's also them transitioning into a new way of living. Now, another area of coaching is in business, small to mid-sized businesses. And you're thinking, well, what's that got to do with health and wellness coaching? Well, think about it. When people own a business, they get stressed out, and that affects their health and wellness. So there are challenges there. The same is true when we talk about executive coaching, coaching in the corporate space, big companies. So yes, the focus is the work and the job and that kind of thing, and the reality is health and wellness plays into it because they're people and their health and wellness affects their ability in the workplace. We talk about career coaching. Well, I started this with a conversation on that. A client coming to me for career coaching, very clear up front, this is what I want, great. And we get into it, and guess what we found out? Health and wellness was a big factor. So yes, it plays in. So health and wellness coaching is hot right now. It's growing. You're hearing everybody talk about it. It's all over the place. So it's a really big area. Who does it apply to? Everyone. All of us. I have a great friend that coaches children who are autistic. That's fabulous. How exciting is that? And we mentioned people going into retirement, etc. You get it across the board. So what's the return on investment for coaching? There's a lot of studies out there. I'm going to be abbreviated in some of this. Hopefully, I'm inviting you to go out and do some of your own research because there's a lot more information available. I want to give you enough to get your interest and encourage you to check it out. So Fortune magazine published an article, and in that article, they talked about the return on investment being 6 times the cost of the coaching. A 600% return on investment. What does that tell you? Bottom line, how can you afford not to have a coach? That's powerful. It's incredible. The most commonly cited study in terms of coaching is from Manchester, Inc., and they cited 570% return on investment. That's, I think, one of them that was used for the average that Fortune magazine published. Now, let's take those definitions we talked about for health and wellness coaching and put it up against this statistic. So when you do training, which is educating someone, you get a 22% improvement. You give them information, you're going to get that improvement. When you combine it with coaching, you get an 88% improvement. So yes, this was done in the workplace. Personnel Management Association looked at productivity in the workplace. I think it very much applies on a personal level, and that's the reason health and wellness coaching is so incredibly hot. It's one thing to give people information. It is another thing to empower them to figure out what they're going to do with that information and how they're going to use that, and then be there as their accountability partner while they go through that process. So very, very exciting. Okay, let's pull up a statistic, back to doing more research, that is about health and wellness coaching. You see, yes, I primarily work in the coaching space, and so my statistics are from all different types of coaching. When you go out and start researching, there's a lot on health and wellness coaching. Here's just one. Health Fairs Direct did a write-up on this, and they said the return on investment was 450%, 4.5 times the cost of coaching. Okay, that's exciting. Think about what that means in terms of health and wellness when you get that kind of a difference. So, of course, people are interested in what health and wellness coaching can do. How specifically does the coach make a difference in doing that? Well, first off, it starts with intention. You see, when people go in and they're given a prognosis for their health, what do you think happens for them? Some people are really scared about it. Some people panic. Some people shut down. Some people get aggressive. Maybe they're angry. What are they going to do and how are they going to do it? And they're really attacking it. So you've got all different kinds of things. How does a coach make a difference? A coach is going to work with somebody to really be intentional. What is it that they want? How do they want it to work? So that they know what their reason is for doing what they're doing. And then what they're going to do is work with the coach exploring the possibilities. Yeah, I've got limitations because of this, that, or the other consideration, and here's what I do control and what is possible for me. And then moving into creating very specific solutions. Here's where I want to go, and then planning how they're going to implement that. And of course, because the coach is there as their accountability partner, it's about using the plan. I have a client I work with and had the privilege of working with them this morning. And one of the things the client shared was, it's just helpful to talk about this, and it's helpful to know you're going to check in with me on whether or not I did these things. And I really like that you're my cheerleader. So this is huge. It means a lot to people, and it's a significant impact that coaching brings to the table. Okay. Health and wellness coaching. Look at it this way. It's a bridge between the awareness, educating, and action because of the focus on the individual ownership and planning. You see, in terms of awareness, a coach is supporting client awareness because more than just giving them the information, they're asking them, what does that mean to you? How does that apply? What additional information do you want and how will you get it in terms of educating? And yes, very often stepping into the role of educator, which is different. And then ultimately asking the client, what action are you going to take? How are you going to take it? Checking in with them later. How'd you do with what you said you were going to do? And applying it. So very, very powerful, and it's a tool that works. I'm hoping what you're getting out of this is, yeah, this is kind of obvious, isn't it? It really makes sense. So yeah, it truly is. All right, so let's dig into the competencies for a coach. The International Coach Federation, which is truly the gold standard as far as coaching goes, training people, what are the qualities, the competencies of a coach. They have the code of ethics, they have membership standards, etc., and the accountability to it. So they put together the 11 core competencies, and they put them in 4 categories. So let's build. First off, setting the foundation. Well, makes a lot of sense. And then we're going to build into co-creating the relationship. Think back to that story. Check in with yourself. Check in with the client. How are we going to work together? Moving into communicating effectively, very important, obviously. And then facilitating learning and results, being that bridge. Okay, so what does that mean in coaching? First off, with setting the foundation, there are 2 specific competencies. The first one is meeting the ethical guidelines and professional standards. Now, here's what we find is interesting. Most of us come into this and say, yeah, I'm ethical, of course. I want to do the right thing. I care about that. And guess what? We don't know what we don't know. So what ends up happening is we think, well, this is the right thing, and we're completely unaware of some of the considerations. So when we talk about coach training, you absolutely want training that's going to include ethics. What are the ethics? What does it mean to me? How does it apply? What do I do in this situation? Then establishing the coaching agreement. And establishing the coaching agreement happens both verbally and in writing. So when we talked earlier about checking with yourself, checking with your client, that's part of the verbal conversation. We talk with clients about what the different roles are, that role clarity we discussed, what a coach is, what an educator is, how are we going to set this up in our relationship, time for each, etc., and then putting that into a written agreement. Now, the next area of competency is co-creating the relationship. So if we're going to work effectively with somebody, that rapport, that connection we have is the biggest indicator of our success. So we've got to make sure we are effectively establishing trust and intimacy with the client. How do we do that? Well, of course it starts with us having ethics and training. That's demonstrating our credibility. That coaching agreement, okay, the client is engaged in this and comfortable with what we're doing and how we're doing it. We're addressing all of that. It also means the next competency, our coaching presence. What is presence? It means being aware. Who is the client? How do they think? How do they process? How do they function? What's going on for them? And then being in the moment with them, dancing in the moment. So coaching presence. And then, of course, as we're working with them, our communication competencies come into play. the ability to actively listen, hear what they're saying and what they're not saying, to ask questions that support them in considering different possibilities, exploring the options, asking questions that, yes, challenge their thinking and expand their thinking so that when they are choosing what they want to do, they're effective with it. They're aware. That direct communication, speaking with them in a way that's clear, it's respectful, and let's go even further with that. It's confident, it's positive, it's proactive in terms of how we communicate with clients. Then, additional competencies in terms of the goal, the relationship, all of those learning they want. So it starts with creating awareness. When we think about educating, creating awareness, we think it's giving information. In coaching, creating awareness is by asking questions so they think about it. And they think about it differently too. And then from there, they're designing their own actions. And of course, as you're working together in this coaching relationship, you're working with them on how you're functioning together and how you as the coach are supporting them in their planning and goal setting. And as a coach, you're their accountability partner. You're checking in with them on their progress, and you're celebrating with them along the way. So how do you pull all of that together? At the Center for Coaching Certification, we have what we call our Staircase to Success coaching model. And our entire process philosophy is built around this model. So if you imagine the coaching engagement as a staircase to success, and you're going to build this with your client, first off, the client is the one who defines success because they're the ones engaging the coach. As a coach, before you're even ready to start building those steps up the staircase, you've got to have a framework in place to hold the steps. What is that framework? That framework starts with your training. The knowledge in terms of the coaching relationship, how it works, developing your skill set so that you have the 11 core competencies as a coach. This is the foundation to being able to build a relationship. And of course, yes, part of this is your ethics, having that code of ethics in place. Now, once you have your foundation for your staircase, you build it together. So you and the client work together in establishing your agreement. You have the verbal conversation, and then you have the written agreement. And when you have your agreement in place, of course, you as the coach are understanding the client. Who are they? How do they think, process, and function? How are you aware of how they do that? So having a model for recognizing what's going on for the client and knowing what to do or not do based on that. Then developing the rapport, because you're going to be present and in the moment. You're building on your ethics and your competency. You're building on your understanding of the client. And with that rapport, your communication is going to be effective. You're listening, the questions you're asking, being clear, direct, and respectful in how you have the conversation. This, in turn, it takes you to the next step of exploration, so that you're asking those questions and the client is exploring their possibilities, choosing what it is they want, and developing their strategy. And that strategy is their step to the doorway called success. You've gone up this staircase to that success by how you build that relationship and work together. Well, the relationship itself, what is the process for that? What's the process for that coaching engagement? Well, when you start a coaching relationship, you do an introductory session. You're getting to know the client, and they're getting to know you. Is this a good match? In an opening coaching session, you're exploring their big picture. What is it they want in all different areas? And that helps create awareness in terms of different values, competing priorities, influencing factors. And from there, you're moving into, okay, so how are you effectively supporting the client so that they focus and engage with what they want to accomplish? in an ongoing process, the client prioritizes what they want, they strategize what they want, they develop their action plan, and then you check in with them on their progress and celebrate their successes with them. And as the client develops new habits and routines and ways of working, they become complete with what you're accomplishing in this coaching relationship. And then as a coach, you're moving into, okay, and how are you supporting this for the long term, maintaining this? And you have a closing conversation where the client is evaluating what they have accomplished, they're evaluating their plan moving forward, and you're actually keeping the door open as a coach so that they know, yes, they can come back to you. So that's your process. Now, when you're working with the client, and here's a model to really consider in terms of health and wellness. We've all, or most of us anyway, have heard about what are called SMART goals. If you're reading the words on your screen, you're noticing there's a difference in some of the words here than the more common model of the SMART goals. So it's specific, yeah, everybody talks about be specific with that goal. If you say I want to be healthy, we don't know what that means. How do you accomplish that? Get very specific and, yes, measurable. What exactly is healthy so that you know what the goal is. You see, an analogy I've used before is if I go into a travel agent and I say I want to go on a trip, and they say, where do you want to go? And you go, well, I just want to have a fun time. I want to really enjoy that. Do they know what trip to book? Of course not. They got to know where I'm going. And they got to know, do I want to go by train, plane, or automobile? So specific and measurable. Now where it gets different is in many models for SMART goals, you see the word achievable. And I'm going to push back on that. Who decides what's achievable? That implies there's assessment and judgment involved. And no, I'm not going there. I'm going to call actionable the A. That means they can take action to move them towards that. Another one is R. Very often in the model you see the word realistic. Okay, again, judgment, assessment. No, not doing it. Resonant. It resonates with the client. It's meaningful, it's significant, it's important to them. And then, yes, the T of time specific. By when do they want to accomplish that? Now, as you look at developing the SMART goals with the client, there are, of course, coaching skills that are very important. So let me give you an example. In a coach training, how are you going to be in the moment and present to your client? Who are they? How are they thinking, processing, and functioning? How do you know that? And how do you adjust to that? So very specifically, one of the things we talk about doing is recognizing, are they emotion or logic? Because how you have the conversation with somebody is different based on whether they're emotion or logic. Are they passive or aggressive? Again, how you have the conversation with them changes whether they are passive or aggressive. So as a coach, knowing how do you recognize it, and then very specifically, how do you adjust based on what it is for them? Because part of that calls for being aware of yourself. Who are you? Because the way you are is influencing how you perceive the way they are. And of course, it all plays in to how you work with them. So you want to be sure that you're really clear on how to identify what's going on for the client, how to keep yourself out of the way, and how to adjust to them based on that. Very important skill. Now let's do another one. Let's do a skill that's significant in terms of coaching versus educating, and also in terms of how we communicate with people. And the way I do the example on this one, by the way, so I have kids, many of you do, and for those of you that don't, think about when you were a teenager. And think about mom or dad saying, and I've done this to my kids, yes, I've made all the classic mistakes and more. I've said to my kids, you need to go clean your room, you need to do this, 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 and this. And guess what my kids heard? They heard Charlie Brown's teacher saying, nah, 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 and that was it. You see, we have this habit of thinking when we tell somebody something, they're actually hearing it and processing. Well, the research shows us people hear one word in 7. That's not very much. So they're missing a lot of that information. What do we want to do? Well, in coaching, basically the communication process means stop telling. They're not really hearing it anyway. It's not working. And instead, start asking. Ask questions. Because when you ask somebody a question, they engage. Their brain's involved. If I ask you a question, what happens? Are you thinking whether or not you're answering me? What's happening right now as I'm asking? So it engages the brain. Now, of course, the way you ask questions, incredibly important. And coaching questions are, in fact, very, very different than any other type of question. And it's a big piece of what people get out of coaching training, the questions, how to ask questions. So I'll give you a few of the tips. First off, it's funny how when we ask questions, we want to sound smart or we want to be helpful and we explain the question. So we end up asking questions that are long and rambling. Maybe we're figuring out what we're asking ourselves while we're asking it, and we keep adding to it to make sure it's clear, and then in fact it becomes very confused and muddled. Or we ask it and we go, oh, I don't like how I asked it. Let me ask it again a different way. And now all of a sudden we've got multiple questions going on. Or alternatively, we ask a question and the other person is thinking about their answer, and we interpret that as, oh, they didn't understand my question. They must be really stupid, so I better explain my question, and we explain it. And all of that gets in the way. So what do we learn as coaches? We learn that powerful coaching questions are, in fact, very short and simple. The shorter the question and the simpler the question, the more powerful and the more opportunity for creating awareness, for the client exploring themselves and coming to their own conclusion. Very, very significant. Now, another thing that comes up, we have a tendency to ask questions in a way that invites the story and the explanation. And people talk about the past and the history, or here are the reasons, etc. Now, wait a minute. We're here focusing on where they want to go and what they want to accomplish and how they're going to do it. So coaching questions focus forward. Very, very important. This is about the future you want to create and achieve and how you're going to do it. So in addition to forward focus, they're truly open to possibility. Because the bottom line is, one of the mistakes people make is they ask questions where they already know the answer. And in coaching, we want to ask questions where we don't know the answer. We're open to whatever the possibility is because it is whatever it is for that client. Now, a really specific tip in terms of asking questions is to ask what or how questions. Because if you start a question with the words is, any, can, do, will, those are all closed questions. If you ask why, it's an attack. They have to defend themselves. So start your questions with what or how. Now, sometimes you'll ask who, when, or where. Most often, it's what or how questions. Very, very important in coaching conversation. Now, additional pieces, skills that you want to develop through your coach training include the focus and the motivation in terms of the goal setting. And what's important there? Well, when you ask a client what they want, it's interesting how often people are able to tell you what they don't want. So if somebody says, well, I don't want to smoke anymore, or I don't want to weigh so much, or I don't want this, that, or the other thing, they're back at that travel agent saying where they don't want to go instead of where they do want to go. And as a coach, what do you learn to do? You learn to ask what they do want. Okay, so if you don't want that, what do you want it to be instead? It's important because until they get specific and measurable with their goal, you have no idea where you're going. How are you going to get there? So asking what they do want. Then their internal motivation. You see, if somebody is doing something for someone else or to avoid a consequence, It's an external motivation, and it has a short-term impact. I'll share an example with you. I had a good colleague, a friend I worked with, a smoker, and he was literally told, "You are smoking yourself to death. You have got to quit. If you keep smoking, you're going to die." And he, in fact, died because he kept smoking. It was everybody else telling him and telling him about the consequence, instead of asking him, what does it mean to you? So instead of smoking, what do you want? And have him explore. I want to be able to breathe. I want to be able to walk up the stairs. I want to be here for my family. And had he gone there, he'd have had an internal motivation for change, and that's more powerful. It's that ownership, that buy-in, and the follow-through you want. And then to have them proactively plan. Yes, there are limitations. What can you do? What is possible within what you control? And have them explore that specifically. So these are coaching skills. And yes, they apply very specifically in the health and wellness coaching. What are some of the niche areas for health and wellness coaching? This is so cool. I'm giving you a few here, and there's a ton of them on your screen. You got 18 listed, and I'm going, that's only some of them. So yes, health and wellness coaching applies in fitness, nutrition, healthcare advocacy, healthcare itself, caregiving, wellness, balance, spirituality, meditation, healthcare navigation, lifestyle, relaxation, home care, self-determination, self-esteem. These are all important. So what are the opportunities for coaching in the health and wellness areas? Well, commercial insurance providers now have coaching because they found out it saves money. When you provide coaching to the people that have health insurance, they're more likely to own their own process and be healthier because of it. For the same reason, employers provide it through employee assistance programs and company programs. Government, oh, I'm getting ahead of myself, government and community agencies are doing healthcare. And again, because of the bottom line impact, there are concierge health and wellness programs, and they're providing coaching because they get a better result. Hospitals and health systems are doing it. It's back to they're finding out that patients aren't following through with what doctors and nurses are telling them. And that, of course, is impacting the whole system and the bottom line. Home care programs. And then, of course, another big one is addiction recovery and rehabilitation. So tons and tons of opportunities for health and wellness coaching. Now, to give you an additional resource, Lisa, who I mentioned has been on the call with us today, has got a class coming up on October 29th where she's going to talk about which hat when, trainer, educator, coach, and help you with more of the specifics in terms of the role and when to use it and how that works. She's got some great examples for you. The link to register for that is on the website, so if you look on the Opportunities tab, there's one for free webinars. Get signed up. Now, think about what you're going to do for yourself. So start developing your own action plan. Yeah, this has been an education, a training program. Take it to the next level for yourself. So what does it mean to you to have coaching as a competency and to truly develop your coaching competencies? And what are you going to do about it? What are your thoughts on that model for SMART goals I gave you? And how is all of this applying in terms of coaching in the fields of health and wellness? What are you doing for yourself in terms of developing your skills? Understanding your client, communication, questions, that forward focus, the internal motivation, and the proactive planning. So we give you a snapshot on those. How are you going further in applying those? And ultimately, what's your process for accountability and then celebrating progress and success along the way? I want to thank each and every one of you for being here. definitely appreciate you investing your time with us. Hoping you got some great insights and information out of this. I do realize we have used our time. I am open to questions. The question panel has been fairly quiet today. That's okay. Hopefully that means you're engaged. As far as that goes, do feel free to type in your questions. Happy to answer those. And for those of you that do have to get going, you've got other things scheduled, please feel free. We are complete. I appreciate you being here. Enjoy the rest of your day and your weekend, and let us know how we can be of service. So thank you, everyone. And by the way, yes, thanks for all the different questions, or I'm sorry, the different comments in the panel. I appreciate that. I'm glad it was helpful to you and that you gained some insight. So thank you for those comments as well. It seems we are complete. I am, of course, available if you have additional questions by phone or email later. You can let me know. Thank you all for being here. I'm going to go ahead and close this out, and then, of course, I will get you a link in terms of the recording, etc. Let's see. So, wow, all of a sudden now you're all throwing out things in the question panel. I got to make sure I can keep up with all of you, so I'm seeing that this answered your questions. It was good. With your regular certified professional coach training, can you be a health and wellness coach? Of course you can. The key is back to what is your expertise in terms of coaching and what is your expertise in the areas of health and wellness. Checking with yourself, checking with your client. Be really clear on the role, which role, when, how are you engaging in that relationship, and making sure you're doing that process in a way that's really effective as far as what you're going. So excellent. Thank you for the thanks. Let's see. And great. So I think we're complete and good on all your comments and questions. Looking forward to staying connected with you and being of service in the future. So thank you, everyone.